Hi, this is Misty Wernsman, Maryville University Advanced Health Assessment, and I'm doing my head-to-toe video today. This is Brian, and he's agreed to help me. Prior to entering the room, Brian emptied his bladder and changed into a gown, and I washed my hands. I've assessed Brian's vital signs, which include his height and his weight. I've also assessed his vision. His distance vision I assessed using the Snellen chart, and the near vision I assessed using the Rosenbaum chart. And that is an assessment of cranial nerve number 2. Now I'm going to start with an assessment of Brian's head and face. Upon assessment, I see that Brian is able to hold his head up in an erect manner without any tics or tremors. His skull is normocephalic and well-rounded, with no obvious signs of lesions or trauma. The skin on Brian's face is pink in color, and the pigment is consistent. When looking at Brian's external features, his eyes and his ears, they are properly placed on his head and properly aligned and symmetrical. Brian, I'm going to ask you to do a series of things so I can assess your facial cranial nerve, which is cranial nerve number 7. I need you to wrinkle your forehead. I need you to clench your eyes shut, clench your teeth, smile, stick out your tongue, and puff out your cheeks. Very good. Okay. Next, I'm going to go ahead and check your trigeminal cranial nerve as well, and that is by touching your face with a hard object and soft object in different areas. You need to tell me when you feel it and if it's hard or soft. Okay. Close your eyes.
Soft. Soft. Hard. 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 Soft. 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 Hard. Hard.
Very good. Okay. Next, I'm going to go ahead and palpate your scalp. I'm going to use a circular, gentle motion going from front to back. Your scalp moves freely over your skull. Do you have any tenderness when I do this?
No.
Okay. I'm going to pay special close attention to your crown, your hairline, and behind your ears. I do not note any nits, any scrapes, any lumps, bumps, bruises, scaliness, or rash. Okay, that looks good. I'm also going to assess your facial bones. Any pain or tenderness when you do that?
No.
They all appear to be intact. Your sinuses, your frontal. You okay?
Yes.
Maxillary.
Feels fine.
Okay, good. No fullness noted there. Great. Okay, good. Now I think I'm going to go ahead and get into Brian's eyes a little bit closer. First, before I do that, I think I forgot to mention Brian's hair. Brian's hair is gray in color, and it is coarse yet soft. He has some bitemporal hair loss noted, but there are no areas of alopecia. So, and when I pull on his hair, it does not come out easily. So that's good. Okay, so onto the eyes now. Upon looking at the eyes, the eyebrows are coarse. They extend out past the outer canthus. Eyelashes extend outward. There's no endo or ectotropium noted. Looking at your conjunctiva and your sclera, pull down. You're tired. They're pink, they're moist, and there's no drainage noted, and no jaundice. Okay, next I'm going to palpate his lacrimal apparatus. No drainage or problems noted there. That's good. Okay, so regarding your eyes, I'm going to do a couple of tests. First, I'm going to check your pupillary response. And I'm going to do this with my pen light. Look at me. Pupils are equal and reactive to light. That's direct and consensual and consensual. Good. All right. I need you to take a look at that hook on the wall to cover one of your eyes. This is the cover-uncover test. I need you to take your hand down and focus on that object. And when he does that, he does not have any strabismus noted. And then do that with the other eye. Okay, good. Great. Good. No problems noted there. And then I also need to check for the 6 cardinal fields of gaze. So I'm going to hold your chin. I just need you to watch my pen light with your eyes only. Don't move your head. Good. And that's an assessment of cranial nerves 3, 4, and 6. Okay. Next, I believe I'm going to. Did I check your TMJ? I'm not sure if I did that. Okay, I'm going to go ahead and do that real quick. If you can open and close. Okay. Any pain? There are no clicks or pops noted when I do that. Okay, so we're going to move on to the ears. When I look at his ears, they are properly placed on his head. They line up with the inner canthus to the top of the ear bilaterally. When I look at the auricles, they go pink in color. There are no lesions, moles, open areas noted, and no nodules noted. If I were to look at Brian's ears with the otoscope, the tympanic membrane, if they were normal, they would be pearly gray in color, and the membranes would be intact. Okay, I'm going to check your hearing now, which is your acoustic cranial nerve, which is cranial nerve number 8. And I'm going to do this with my tuning fork. The first test I'm going to do is the Weber test. I'm going to strike the fork. I'm going to place it on the top of your head, and you're going to tell me if you can hear equally on both ears.
Yes.
Okay, good. The next test I'm going to do is called the Rene test. I'm going to strike the fork. I'm going to place it on your mastoid bone. You're going to tell me when you stop hearing the fork, and then I'm going to turn it, and then you're going to listen again, and you're going to tell me when you stop hearing. And I'm going to watch the clock on the wall over there at the time. Oops, sorry.
Now.
Okay.
Now.
Okay, good. Again, on the other side.
Now. Now.
Okay, good. So your air conduction should be 2 times longer than your bone conduction, so a 2-to-1 ratio, and that's about what yours appeared to be, so that's normal. Another test I'm going to do to test your hearing is called the whisper test. I need you to cover up one of your ears, and I'm going to say a series of letters, and I want you to repeat them back to me.
RMW.
Okay, other ear.
AJW.
Yes. And for this test to be considered normal, the patient should be able to repeat the letters back at least 50% of the time accurately. Okay, so next I'm going to assess Brian's nose, and upon inspection, his nose is straight, symmetrical, and it doesn't appear to be swollen. On palpation, it feels okay. Any tenderness?
No.
Okay, good. Okay. The septum appears to be midline. I'm going to look at your nose with my little light here. Okay. The membranes are pink and glistening. Pink and glistening. The turbinates are present. They are the same color. I do not note any bogginess, paleness, or bluish color, which would indicate allergies. I did not see any masses, lesions, blood, anything like that. I did notice a little bit of drainage. Okay, so I need you to check the patency of your nares. I need you to cover up one of your nares. And breathe. Do it again on the other side. And breathe. Did that feel equal?
Fine.
Okay, good. All right, moving on to your mouth. Brian's lips appear to be symmetrical. There are no cracks, fissures, open areas noted. Can you open your mouth and stick out your tongue? Okay. Tongue is a dull red color. It is moist. I'm also going to look with my light, my tongue blade. You open. I'm going to look at your buccal areas, which are also pink and moist, and see open areas and lesions. Your gums are nice and pink. No redness or gum disease noted. No inflamed areas. Your teeth all look like they're in good condition. I see that you've had some fillings. Looks like you do grind your teeth a little bit. That's okay. I also need to look at the roof of your mouth for your hard and soft palate, and those are intact. Can you take your tongue and touch the top of your mouth with it? And the roof of your mouth, or the floor of your mouth looks good. There's no varicosities noted in the veins. Can you let me look now at the back of your throat to the oral pharynx? You say, Because you still have your tonsils. They are 2+. They are not enlarged. Anterior and posterior pillars are noted. The uvula is midline. There's no redness, no drainage, no lesions noted. And the last thing I need to do is I do need to gag you to check for cranial nerve number 10, so I apologize. Gotcha, I'm sorry. Okay, that's good. All right. Next, I think we're going to move down to the neck. Upon inspection of the neck, look at the trachea is midline between the sternocleidomastoid muscles. The trapezius muscles are symmetrical. The thyroid does not appear to be enlarged. There's no goiter noted. There's no sign of jugular vein distension noted. I'm going to palpate. Can you swallow? When he swallows, the thyroid slides up like it should, so that's within normal limits. I need you to turn your head side to side, back, touch your chin to your chest, touch your ear to your shoulder, your other ear to the shoulder, good, and shrug. Okay, now we're going to get with some resistance. Okay. Good. All right, that's all. It's all normal, and that is cranial. The shrugging of the shoulders is cranial nerve number 11, spinal cranial nerve. Okay. Next, we're going to assess your lymph nodes, and I'm going to palpate first your occipital, post-auricular, hold your head up, pre-auricular, submandibular, tonsillar, submental, supraclavicular, infraclavicular, axillary, your anterior chain, or anterior cervical, posterior cervical, and deep cervical. And there's no lymphadenopathy noted, so that's normal. Next, I need to assess your carotids, and they are present and equal, and I need to auscultate them for bruise with the bell of my stethoscope. So we'll take a deep breath in and hold it. Good. Deep breath in and hold it. Good. And then I need to auscultate the thyroid. Great, no bruise noted. Okay, good. Next, I'm going to move around to the posterior chest. Upon inspection, respirations appear to be even and unlabored. The skin is pink. He does have some scattered freckles with some large moles noted to his back. I'm going to look at the cervical spine. It appears to be straight. Coming down, there's no curvature noted. I'm going to palpate your spinal processes. Those all feel okay. No protrusions noted. I'm going to percuss down the spine. Do you have any pain or spasms?
No.
Do that? Pump the belly a little bit. Okay, so next what I'm going to do is I'm going to percuss. So I'm going to do that in a systematic fashion. Side to side. Resonance would indicate possible air trapping, and dullness could indicate some consolidation or some fluid. I'm going to do some lateral percussion as well. Good. I'm also going to have you do check for tactile firmness by having you say 99.
99, 99, 99, 99.
Very good. And I'm going to also, if I were going to assess your diaphragmatic excursion, what I would do is have you take a couple of deep breaths, and I would have you take a deep breath in and hold it. And I would percuss down. And it would be a resonant sound, and wait till I get to a dull sound, and then I would mark it with a marking pen, and then I would have you breathe normally for a couple of breaths, and then I'm going to have you take a deep breath out, or exhale and hold it, and then from that line I'm going to percuss up until I hit resonance, and then I'm going to mark it, and then that area between is, the normal is 3 to 5 centimeters, and it's normal for the right side to be higher than the left because of the liver. So I believe that's everything on the back. I'm going to move around now to the front. Again, inspecting. The skin is pink. There's some freckles noted, not as many moles. Respirations are even and unlabored. I'm going to palpate. Do you have any pain?
No.
I'm going to have you do 99 again.
99, 99, 99.
Very good. Okay. And we're also going to percuss the front. Very good. Okay. I also need to palpate the cardiac area. I need to palpate the precordium, left lateral, and the apex. And I'm checking for thrills or heaves, and they're unloaded. Okay. Next, I'm going to go ahead and auscultate the breath sounds on the front. Systematically. Did I do that on the back? I can't recall. I'm going to go ahead and look at the back just in case. Lateral. Okay, good. Right, and I also need to auscultate your cardiac sounds, starting with your apical, pulmonic, Erb's point, tricuspid, and mitral. I'm listening for the S1, S2 sounds. I'm also listening for any gallops, rubs, clicks, or murmurs, and I do not have any of those. Okay, I think now we can go down to your abdomen. So if you want to lay back. All right. Just upon assessment first, an inspection of the abdomen. I know the color is pink. I know the contour, which is flat. I'm looking for any abnormalities, any scarring. I don't see any peristalsis, anything like that. I don't see any obvious herniations or bulges or lumps. The next thing you do on the abdomen is you auscultate. And I'm going to auscultate first for breath sounds, or excuse me, vowel sounds in all 4 quadrants. And the vowel sounds are present in our 4 quadrants. If I were to not hear vowel sounds and I wanted to document that they were absent, I would have to listen for 5 minutes continuously. I also need to auscultate for the arteries with the bell of my stethoscope. aortic, right and left renal, iliac, and femoral. And there are no brewing or whooshing noises noted, so that's normal. Next, I'm going to percuss the abdomen. You can note a variety of noises on the abdomen, from dull, resonant, to timpani. That is all normal. If I want to palpate for the liver borders, what I would do is start at the mid-clavicular line, work my way down, and it's resonant until I go to a dull sound, and that would be the top edge of the liver border. And then I would do the same, working my way up. Same thing, you have resonant until you hear dullness, and that would be the bottom edge of the liver border. You do the same thing for the spleen, and that would be from the outer aspect of the axillary line down to the 6th to the 9th rib, down to where there's a dull area. Then if I wanted to do a light palpation of the abdomen, I would do that. Everything feels normal. I don't feel anything that's abnormal, anything bulging, anything.
No.
And then you could do a deeper palpation. If I wanted to try to palpate for the spleen, I could do that. Take a deep breath in. Out. Spleen is rather hard to palpate unless it's abnormal, so it's normal, but I can't feel it. I'm going to go on the other side and assess the liver. Same thing, take a deep breath. Out. I don't note that the liver appears to be enlarged. If you're having trouble palpating, you could use another method called the hook method, where you have the patient take a deep breath in, and then you kind of hook your hands underneath under the rib cage. So that's normal. Okay. Also need to feel for the kidneys bilaterally. Okay.
Yeah.
Right. One thing I forgot to do on the back when he was sitting up, and I'm going to go back and do, is I forgot to palpate and percuss the costovertebral angles. So I'm going to do that now. I'm going to percuss. Any pain?
No.
Okay, and that would indicate that there would be issues with the kidneys if you had any tenderness there. Sorry about that. Okay. And now we're going to move down to the lower extremities. His legs are symmetrical and as far as their size, their muscle mass, hair distribution. He does have some hair loss noted to the lower front shin area of the legs bilaterally, and that's equal on both sides. The color is pink. There's no paleness. There's no mottling. The legs are warm to touch. I'm going to assess his pulses. First is pedal pulse, post-tibial, and if I could, I would assess the popliteal in this area if I could, but I don't know if it would feel that. And again, I'm going to feel for the pulses, pedal, post-tibial, popliteal. Okay. I'm also going to assess for the joint there, the knee. I'm feeling crepitus, pain behind in the popliteal space. Okay. Right. I also need to do your upper extremities while I'm doing the extremities. So I need you to put your arms out. And again, the extremities are symmetrical as far as muscle mass, hair distribution. Okay, color is nice and pink, warm to touch. Looking at his hands, his nails are well groomed. The nail plates are firm but smooth, and the bases are hard. The nail bases are hard to touch. There's no clubbing. The capillary refill is less than 3 seconds. Looking at the joints, there's no swelling. Any tenderness noted?
No.
Good. How about in your wrists?
No.
Elbows?
No.
Shoulders?
No. No.
Okay. All right, so next I think what we're going to do is check your deep tendon reflexes, and we'll just go ahead and do the upper ones while we're up here. So if you can just lay. Okay, so to do the brachial radial, I'm going to strike the hammer on the tendon. Okay. Good. Very good. I also need to assess your radial pulses. Equal brachial pulses. Equal fit. Right. And then I need to assess your reflexes for your knees. So just relax your leg. Okay, good. And I also need to check your Achilles. Just relax. Right. Good. All right. Next, I think what we'll do is have you lower the bed yourself, and I'll have you stand up. And could you just walk around the bed? And I'm just assessing his gait. His gait is steady and brisk, and no weakness or abnormalities noted there. I also need to have you, I'm going to look at your spine again a little closer. The cervical and the thoracic and lumbar spine is straight. There's no curvatures noted. Again, I felt the spinal processes earlier. It all feels normal. I'm going to assess the paravertebral muscles. Any problems? Any spasms?
No.
Pain?
No.
And kidneys. Okay. You reach down and touch your toes. Okay. Back up. All right. Can you put your hands on your hips? Can you bend back? And bend side to side. Twisting motion. Twist. Twist. Okay. All right. And looks like your musculoskeletal, all of that is intact. Go ahead and have a seat, and I believe that this concludes our head to toe assessment. Thank you for watching.